Why is the HOMA-IR test important for fertility? Have you ever wondered how your body's metabolism might be affecting your chances of conceiving? The HOMA-IR test is a simple but powerful tool that helps answer that question. It measures insulin resistance, which is a key factor in many fertility issues, especially those linked to hormonal imbalances and conditions like polycystic ovarian syndrome. Insulin resistance occurs when your body doesn't respond properly to insulin, leading to higher insulin levels to keep blood sugar in check. This imbalance can interfere with normal reproductive functions. In women with insulin resistance, the excess insulin can disrupt hormonal balance, especially by increasing androgen production in the ovaries. This excess androgen can cause irregular or absent ovulation, which makes conception more difficult. Research shows that insulin resistance reduces the development of multiple follicles during ovulation, meaning fewer eggs are matured and available for fertilization. When fewer eggs develop, the chances of conception drop significantly. The connection between insulin resistance and polycystic ovarian syndrome is especially important. Many women with PCOS have elevated HOMA-IR scores, indicating insulin resistance. This condition not only causes irregular periods and missed ovulation but also worsens hormonal imbalances that impair fertility. Addressing insulin resistance can help restore more regular ovulation and improve fertility outcomes. For those undergoing fertility treatments like in vitro fertilization, knowing your HOMA-IR score is vital. Elevated insulin resistance can lower the success rates of these procedures. It can lead to poorer embryo quality and lower implantation chances. Studies have found that women with higher HOMA-IR scores tend to have fewer successful pregnancies and are at increased risk of complications like ovarian hyperstimulation syndrome. Insulin resistance also affects the uterine environment, making it less receptive for embryo implantation. High insulin levels can impair placental development and alter immune responses in the lining of the uterus, increasing the risk of miscarriage. Even if fertilization occurs, a resistant metabolic state can prevent the embryo from successfully attaching and growing. The HOMA-IR test involves measuring fasting blood insulin and glucose levels. A score of 1.7 or below generally indicates good insulin sensitivity, while a score of 2 or higher suggests insulin resistance. For a more detailed picture, some doctors recommend additional tests like the oral glucose tolerance test, which measures how your body handles sugar over time. These tests help identify insulin resistance early, often before blood sugar levels become abnormal. Since insulin resistance often comes with increased inflammation, testing for markers like C-reactive protein can also provide insight. Inflammation can harm egg quality and disrupt ovarian function, further complicating fertility. Managing insulin resistance through lifestyle changes, diet, and sometimes medication can reduce inflammation and improve reproductive health. While most research focuses on insulin resistance in polycystic ovarian syndrome, emerging evidence suggests it may also play a role in endometriosis-related fertility issues. The inflammatory environment created by insulin resistance could potentially worsen endometriosis symptoms and impact fertility, though more studies are needed. Understanding your HOMA-IR status allows healthcare providers to tailor treatment plans. For example, women with PCOS and high insulin resistance may benefit from medications like metformin, which can improve insulin sensitivity and boost fertility. Early detection through testing can also motivate lifestyle changes like healthier eating and increased activity, which can naturally improve insulin response. In summary, the HOMA-IR test is a key step in fertility evaluation because it uncovers hidden metabolic issues that can be corrected. Addressing insulin resistance early can improve ovulation, egg quality, uterine receptivity, and overall chances of conception. If you're experiencing irregular cycles or difficulty conceiving, talking to your healthcare provider about insulin resistance testing might open doors to new, effective strategies for achieving pregnancy. Always remember, individual medical needs vary, so personalized advice from a healthcare professional is essential.